I'm Dr. Benedict Raj. I'm a cardiac surgeon with special interest in pediatric heart surgery, that is, children with heart disease. I work out of Columbia Asia Whitefield, Bangalore. The commonest heart conditions that we treat are because of various reasons. The first and most common being cholesterol blocks in the heart. This causes heart attacks. Two common words you've heard: cholesterol, heart attack. The other common condition that we hear is that blood pressure increases the workload of the heart and can cause heart disease, and one of them being again heart attacks. So most of the heart attacks are now treated by the cardiologist by putting stents. But some patients need surgery, and that's where surgeons like us come in. The next common condition you might hear about is blocks to the valves. Every heart has got 4 chambers in which there are 4 valves, and each valve opens and closes with each heartbeat. And if this valve gets blocked, to pump blood through a blocked valve, the heart has to work much harder and the heart will fail over a period of time. So these valves we can either repair or replace. Another condition is the heartbeat, instead of being normal, can become irregular. So it beats in a very irregular fashion. Stops, then beats. Stops and then beats. Beats one time slow, one time fast. So this is not good. So that can also be corrected by either the cardiologist in the angiogram cath lab or by the surgeon if there is an associated another lesion inside the heart. Another common condition is when you say that the heart has become so weak that it is not able to pump blood that we have to think of either giving medicines or putting machines or even transplanting the heart. And at Columbia Asia, we have these services for all these conditions. Another common condition we have among our patients, you would have heard about, is a hole in the heart. The commonest heart disease among children is VSD, or ventricular septal defect, in which there is a hole between the 2 big pumping chambers of the heart. The left and the right are separated by a wall so that the blood doesn't mix. If there is a hole, the blood can go from left to right and into the lungs and damage the lungs. So this hole has to be closed. Sometimes this hole may be associated with a block in another blood vessel inside the heart. So this can result in blood flowing the wrong direction. So more of the blue blood goes from the right to the left, mixing with the blood going to the body and making the patient blue. So this is a correctable condition which can be corrected. You would have heard also that some patients develop blood clots within the heart which can fly either into the lungs and block the lungs or into the brain and block the brain, causing a brain attack or stroke. The same thing can happen to the legs or the hands. So these clots, we have to find out the reason and treat the reason. The last condition I want to tell you is about a very, very abnormal heart in which a child is born not with 4 chambers in the heart, but maybe only 2 or 3. In which condition, this child with modern technology can be made to live for up to 15-20 years. But at that period of time, we have to go through several stages of surgery, and when there comes a time, technology can keep these children alive for a normal period of life like you and me. To get them to that stage, we may have to do 2 or 3 stages of surgery. And all this is possible in India because we have been operating on different types of people with different types of heart disease for the last 30-40 years, and our results are as good as the rest of the world.